In many ways, it is a good move, and certainly in terms of the workforce, particularly with public services, in terms of high level of sickness and putting services like the health service and social services at risk, as well as much of the supply chains, to be able to reduce it from 7 to 10 days, 7 to 5 days, is very positive. The key thing is it safe? And the UK security agency have looked at in detail, and it is safe. There still is a small risk of infection. So when it was 7 days, after that, with 2 negative lateral flow tests, the risk was considered to be 6% of further infection. Reducing it to 5 days only increases the risk to 7%, and clearly with all the cautions and wearing masks and being careful in terms of contacts, that's thought to be a very reasonable judgment. But clearly it will help particularly the public services and where some staff shortages are low. So overall, yes, I think it is a good move and bring us in line with countries such as America, really.
Yeah, and there's talk that these changes apply to, I quote, fully vaccinated people. So what does this mean for those people that haven't had the vaccination?
So what it would mean is that they would still have to take the full 10 days isolation, and that's a precaution that's sort of appropriate at that level. So yes, if you're unvaccinated, it is a full 10 days vaccination, 10 days isolation. In the same way as if you don't have 2 negative lateral flow tests, then your self-isolation period will increase really, and until that is the case, and you haven't got symptoms, just to reduce the risk ultimately.